Dr. Harnick, what's the difference between braces and Invisalign?
Well, in the past when we used to move teeth, pretty much all we had was metal braces with metal wires, and you were able to straighten the teeth, and this of course works excellently. Been doing that for more than a quarter of a century. Along the way, people didn't like the metal braces, so we went and had braces that were made out of a porcelain. When they first came out, there were several issues with them, breakage of teeth and breakage of brackets. However, the companies and the materials have improved over the years, and you can see with the lips around, it looks more just like a retainer. They have tried making white wires, but the white wires don't always work as well, and we're not big fans of them yet. However, they are coming. Then, in around 1998, 1999, somebody was smart enough to figure out that you can move teeth with clear plastic aligners. And these are computer-generated aligners, and each one snaps over your teeth, and each one moves your teeth a little bit more than the one before. And so you get a series of these. Each aligner is worn for 2 weeks, and then you change it yourself for in 2 weeks. And so I usually give out 3 sets or more of aligners, so we see you once every 6 weeks. What's nice about the aligners is you can eat normally, and you can brush normally, and then you put them back on. They have to be worn all the time except when you're doing those 2 things. They're a little less painful, and obviously they're a little less noticeable. One of the things with Invisalign is that we use these little white attachments on the teeth, and these help the Invisalign grab certain teeth so that we're able to move them and mimic the exact movement of braces. I'm finding Invisalign works just as fast or faster than braces, because with braces a lot of times we deconstruct the bite and then have to put it back together again, where Invisalign is a very methodical way. It's sort of like the tortoise and the hare race, and the more methodical way sometimes wins. Regardless, neither one of them takes all that long, and we can get very, very excellent results. Many people are told they're not candidates for Invisalign, and I feel that's because many orthodontists are new to Invisalign. I've been doing Invisalign since the day it came out. I was in one of the first groups to be trained in the world, and I've been on their alpha group and have done studies for them, and so I'm more and more comfortable with them, and we can do more and more things. I liken it to eye surgery. It used to be that they could only do nearsighted people. Then they could do nearsighted people with astigmatism. Then they can do farsighted people. Now if you're breathing, they will do your eyes. Well, Invisalign is very much the same kind of technology. As computer work improves, so will the Invisalign. They came out with some new material just in January of 2013 that's a little softer and clearer and seems to be working better. You should, if you are considering braces, if you're considering orthodontics now, you should consider both the braces or Invisalign. Doesn't matter which one you choose, but you can get a beautiful smile either way.
Thank you.